Once again, we're glad to have patient advocate Cindy Gatton on the program with us. My favorite segment where we talk about healthcare consumerism. And that's what Doc Talk is all about. It's about your health, your money, and your choice. If you miss any part of this segment, go to my website, entinstitute.com, where you can hear all of Cindy's segments. She's become a regular on the show. Glad to have you, Cindy.
Always good to be here.
I love stories. You bring stories with you. And today you have a story about one of your clients that you advocate for, Bill, who was diagnosed with prostate cancer. Let's hear Bill's story and talk about the dilemmas you helped him with.
Bill is a 56-year-old client who contacted me after getting a cancer diagnosis.
Not a good thing.
And I think for most of us, when we hear the word cancer, it's a life-changing moment.
Oh, it is. I tell you, as a physician, I got out of the cancer business because it was my choice. I hated giving people bad news like that because the minute you say cancer, I'm telling you, they don't hear another thing you say for a period of time. I don't know if it's 5 minutes, 10 minutes, or 10 days, but yeah, when you hear that, it changes your life.
It absolutely does. And I think as patients, if we think we might be getting that information, it's really important that we take someone with us when we hear it.
Great point.
Bill didn't have anybody with him when he got that information. And his doctor outlined for him that there were several options. He was really unclear about what option he should take. And I think, like many of us as patients, we want to know what the finger quote best option is.
Absolutely. I'm not only a doc, I'm a patient too. And I have the same concerns and fears. I'm very limited in what I do now. I'm an ear, nose, and throat doc. So I'm like any other patient, and that's right. We want to know the whole truth, nothing but the truth. We want transparency. I love that. We want transparency.
Well, transparency is a good thing, and it can be a complicating thing because we know that there are, I don't know the exact figure, but 30 to 40% of disease states don't have a best treatment. They're what we call preference-sensitive conditions, meaning that for us as patients, our preference plays a very large role in what the best treatment for us might be. So the best treatment for me might not necessarily be the best treatment for you.
That is so true. That is so true. And therefore we have, again, healthcare consumerism, to make decisions about what's best for you. But when you have cancer, that's a little different story, a heart disease, death and dying issues that are not just quality of life issues. When it is about that, wow, you're told that you have cancer, and now you need to find out what all the options are. Did he find out that?
He did. He went to the internet, which again is one of those good, bad, and ugly things. There's a lot of information on the internet that is accurate and very helpful. There's a lot of information that's not so much.
And that's a very good point, because as a doc, a lot of doctors don't like their patients. I read on the internet this, but I encourage it myself. The problem is exactly what you said. There's a lot of misinformation.
So one of the first things that we did was to look at where he'd been looking for information and to vet those sources to see if they were credible, reliable. And they were. The places that he'd been looking were pretty good information. He did what I would recommend any patient with a serious or life-limiting diagnosis, when they receive that diagnosis, to get a second opinion, and he did.
Right. I totally agree.
And the second opinion confused him even more because this physician really was leaning towards radiation. Presented all the options, but his preference was towards radiation.
And that was his original physician.
This was actually the second physician. First physician said, you've got these choices. And he went to the second physician and said, you've got these choices. My preference is radiation. And that kind of concerned him. So he sought a third opinion. And that particular surgeon leaned towards surgery.
Well, they are surgeons. So
Indeed.
You have to look at the bias there.
Indeed.
No doubt. So we went to a third.
And that was when he called me and said, I don't know how to make this decision. Everybody's got their own opinion. The literature that I'm reading doesn't point to one treatment being more successful than the other. How do I make this decision? As patient advocates, we're actually trained to help folks do that, to understand that what might be important to you isn't necessarily important to me. There's a tool that you can access on the web called the Ottawa Personal Decision Guide.
Yes.
It's actually useful for things beyond just making medical decisions. But we worked through the Ottawa Personal Decision Guide to understand what was really important to him. The financial aspects of a cancer diagnosis are huge because there's medical financial costs, but there are other costs. I'm going to miss time from work
Oh, so true.
for treatment, and that's got a financial cost.
It does.
You
It
know,
does.
maybe I'm not going to be able to work for a little while. And that's something that I might need to consider as I'm considering my options. Maybe I've got an employer where that's not so important. These are the things that make treatment so highly individualized. And we can't be effective partners for our physicians unless we really understand where our beliefs, values, goals, and objectives lie.
Once again, we're talking with Sidney Gatton, who is a patient advocate. With regard to his decision, he had to find something that worked best for him and his current diagnosis. And, we don't have the time to go into stages of prostate cancer and whatnot. It's very individualized. There are probably 100 different options. So what made his decision? What helped him make his decision about his treatment course?
That's a fascinating question. It would be very interesting to hear what it finally was that sort of tipped him in one direction or the other. I would say in observing his process that he began to realize that his work and his ability to function at work was what was most important to him. But I would also say that the idea of a cancer diagnosis was really uncomfortable to him, and he wanted it removed. The idea of medical treatment, radiation,
Right.
just didn't sit so well with him. And, I might note he was also an engineer. And so this kind of aligned with a lot of his core values. So he elected to have surgery. He was very, very careful about the surgeon that he chose, that the surgeon had a lot of experience so that he could minimize complications with that. And I'm happy to report he's doing very well.
That is great. Okay. That's a great story. So he's doing well now, and a lot of people should know, diagnosed early, there's a lot that you can do, and the surgical therapies are important. In his experience with the doctors that he consulted, did he feel that there was any biasness in their recommendations? Again, they're surgeons. As surgeons, we tend to operate, but as a patient advocate, you hope that they do the right thing.
I think it would be unfair to think that physicians don't have treatment preferences. But he did experience that. And I think the dissonance for him was they weren't able to disclose to him why they had that treatment preference.
And did you discover any?
Well, I mean, the second surgeon he consulted with felt strongly that surgery was the best option. It's possible that surgeon shared his viewpoint that removal is better than a medical treatment, that it just aligned better with his own personal values. Because the literature doesn't show that one treatment is better than the other. And I think this is hard for us as patients because we look to our doctors to help us make that decision, to be transparent, to understand why they recommend that so that we can be effective patients with them.
And does he live in Atlanta?
Actually, he doesn't.
Wow.
He lives in Arizona.
And how did he find you?
He found me through some work that I do through the faculty position that I hold at the University of Wisconsin. We operate a telephonic patient advocacy center there, and I think one of his surgeons actually had recommended that he contact us.
That's great. That's great because his experience is a great example about transparency and education. And as healthcare consumers, that's what we need. We need to do. When he was going through this process, did you help him with regard to the financial aspects?
For this particular patient, for Bill, the thing financially that he worried about, he had good insurance, but he worried about what it was going to mean in terms of time away from work. Radiation was going to mean that he was going to have to miss work for a period of time to go in and have radiation be monitored for that. There were long-term monitoring that he really just felt that that time away from work was going to impact him financially in a pretty significant way. And I think that may have influenced his decision to have surgery, which is sort of a one and done kind of thing. Miss a week's worth of work and, yes, regular monitoring, but be able to get back to work after that.
I find it very interesting that he was very methodical about this. And again, another proactive patient advocacy that you've done. I think there's going to be a lot more of that in the future. So he was in Arizona, and you helped him with the minefield of insurance. So his providers were all on his plan.
They were. He actually elected ultimately to have his surgery at the Mayo Clinic in Scottsdale, which was not home for him.
Okay.
He had to travel to get there, but he had family there and a way to be in close proximity for the follow-up right after his surgery.
Well, it's very complicated. I know we try to simplify this for our listeners, but it is very complicated. So you're given a diagnosis of cancer, and the last thing you want to think about is consumerism. But you're consuming it. Forget the price. You want the best quality, the best therapies out there. So as a patient advocate, you help people go through the process and discover why it is best for them, even medically, not just financially.
We will never make a decision for a patient, but one thing that we can help them with is to look at the medical literature, look at the studies, and make sense of the statistics.
Wow, what a great industry. So your advice for patients listening with regard to cancers now, what would you tell our listeners?
I would tell listeners, first of all, if you have a serious illness, if you get a cancer diagnosis, consider a second opinion. Only about 30% of cancer patients actually consider getting a second opinion, but it can be very, very helpful. Cancer is not just one disease, it's many diseases, and the treatment approaches can vary quite a bit.
They can, they really can. I think getting multiple opinions is the right thing. I think Bill did the right thing, and Bill, follows that mantra. It's your health and your money and your choice. Being an educated consumer is what it's all about. Thanks for joining us today, Cindy. Glad to have you back.
Always a pleasure.
I'm Dr. Jeffrey Gallops, and this is Doc Talk on Talk Radio 640 WGST.